All right, so I think we're going to go ahead and get started here. And if anyone jumps in, you can feel free to ask questions in the bottom. I'm trying to keep an eye on the comments coming up, but I'm Steph. I'm a nurse practitioner, women's health specifically. I've been working in IVF or reproductive medicine for over 6 years now, and I was a labor and delivery nurse before that. I am on the Premom app, so virtual consults, all of that. I'm partnering with Premom to help give you guys advice. I also am part of the team that's sending out the QA responses. So if you've been following along with the newsletters, I'm the one behind the computer answering those along with Dr. Habe and Nurse Linda. So what we're going to go over today is the topic of trying to conceive after birth control. A lot of clients present with questions, how long does it take for my regular cycles to come back? What do I need to pay attention for? And that's kind of the topic we'll be going over today. And then what we can do is answer questions kind of after a quick overview of everything, and we'll go from there. So overall, in general, there was a great study that was done that included over 187 women, and those were women who had been on a birth control pill for over a year, which is important because most of the clients that have these questions are wondering, they've been on long-term use and they wonder if it impacts their fertility. So from that study, over 97% of women had a return of their cycle within 90 days. The average was 32 days. So, the up-to-date literature shows that within 90 days, we would expect you to have a full return of your cycles, but that 3-month window after coming off of birth control can be a little bit variable for some women. Technically, it can take up to a year. However, like I said, 97% of women within 90 days will have a return of their cycle and fertility. So remember, when you're having a menstrual cycle, what's happening there is that follicular phase in the beginning is estrogen dominant. The body is pumping out hormones to stimulate the ovary to grow a mature follicle. When that follicle releases an egg, then your progesterone increases. So those of you who are tracking with Premom are doing your LH strips and you're looking for that LH surge. Once that LH surge comes down, ovulation occurs about 24 to 36 hours after that. And then your progesterone will rise. So when your progesterone rises, it stays elevated. Your basal body temperature can increase by about 0.5 degree or more. And then what brings on the onset of your next period is if your body doesn't detect the HCG hormone, the progesterone drops. When the progesterone drops, that's what initiates your next cycle. So what happens is when you come off the birth control pill, it takes a little bit of time for your body to re-establish this balance between the estrogen, progesterone, and luteinizing hormone. So you just got to give it a little bit of time, but some people may have a cycle exactly, about a month later right away. Same goes for an IUD. So those of you with Mirena or Skyla, anything like that, return of fertility is actually even quicker than the birth control pill because the IUD hormones are not systemic throughout your body. Those hormones stay local to the uterine cavity. And especially if you have a copper IUD, there are no hormones at all. So as soon as that comes out, the fertility, again, is very similar to that of a birth control pill. And then same with Nexplanon. So anyone who has Nexplanon, which is the implant in the arm, has the same return of fertility within about 3 months of 97% of users. The only type of birth control that does not have a quick return to fertility is something called Depo-Provera. It's an injection. Most patients get one every 3 months, but that can take on average about 9 months for your fertility to return. So my suggestion would be if you're on Depo-Provera now and you know that you're going to be trying to conceive a baby this year, don't get another injection at this point. If you're not quite ready yet, let that Depo-Provera wear off, and then you can use a barrier method such as condoms or short-term use of the birth control pill until you're ready to actively try to conceive. But if you stop Depo-Provera and you're ready to try right now, it could take really about 9 months for your cycles to return. So that's the main data present on all of that. And in terms of knowing if your cycle has returned, the first cycle may not be clear because if you stop your birth control pill and you don't have a bleed right away, you may ovulate prior to that next cycle. So when you get your first period after coming off of the birth control, that would be when I would start tracking, testing your days, doing your LH strips, following your cervical mucus, testing basal body temperature. There is a free ebook that Premom offers, so you guys can read over a ton of helpful information there. But I'm going to look here down at the questions and see if anyone has questions based on the certain type of birth control they're taking, or just questions about return of fertility after birth control. And then I'll try and go over any live questions right now. Let's see, I don't see any so far. What's a good time to test the LH strips? Okay, so Misty has a question here about LH strips. So typically the first cycle or two that we are using our LH strips, we recommend starting kind of shortly after your period ends, at least 5 days before your expected ovulation. So if you think you're going to ovulate on day 12, I would really start around day 7 or so doing your LH strips. You can just do once a day in the beginning. If you find out that eventually you have what's called a rapid LH surge, we suggest testing 2 times a day, but you don't need to do that starting on day 7 or 8. Once you learn a little bit about your cycle, and the more you log with the Premom app, the more the intelligence is going to recognize your personal patterns. Then you can start testing around day 10 or so. That day 10, 11, 12, you're kind of just getting those baselines so you can see that line progression of it, the test and control ratio getting darker. But if you haven't done any LH testing before, I would start around day 7 or so, which is approximately 5 days before early ovulation or ovulation on day 12. Start day 7. If you find out that eventually you ovulate later, like day 17 or 18, a little bit later in your cycle, you can start LH testing around day 13, 14. But it takes a little bit of time to figure all that out. Let's see, can ovulation be confirmed 100% by BBT? So great question, Katie. So basal body temperature is a really nice way to kind of do a dual confirmation. We don't recommend only testing ovulation by basal body temperature rises because sometimes it can be really, really difficult to get accurate readings. Premom does offer an awesome basal body temperature thermometer that connects Bluetooth with their app. So that way you don't have to, chart it, write it down, anything. It will sync over your temperatures right to your chart in the Premom app, and it will create a really nice graph and create a cover line for you. Some people, though, don't have accurate basal body temperatures for a variety of reasons. Either they are active in the last bit of their sleep, which can artificially raise their body temperature, or if you forget and get up and run to the bathroom real quick and then remember to take it, it could also alter that temperature. So it's not something that I would rely on 100% as your sole confirmation. The luteinizing hormone strips are going to be the best way to check with a basal body temperature as a dual confirmation. Hopefully that's helpful. All right, next question here. My last cycle, I ovulated day 24. Does this basically mean I am out due to so late in cycle? No. So the quality of the egg that cycle does not per se, does not diminish because you ovulated later in your cycle. So what makes my cycle different than your cycle, Hillary, is that I may ovulate on day 14. So the follicular phase is the variable phase. What makes my cycle shorter than yours would be if I ovulate sooner. But if you ovulate day 24, it doesn't mean that anything is wrong with that egg. I still would want to make sure that after ovulation, you still have at least an 11-day window of the luteal phase. So the luteal phase is that progesterone phase that's really dominant. That's there to support pregnancy. The follicle that you ovulated from is going to be pumping out progesterone to help support potential pregnancy. So as long as you have that 10, 11, 12-day window, an average luteal phase is about 11 to 17 days. So as long as you still have that luteal phase after your 24-day ovulation doesn't mean you're out at all. Irregular ovulation makes things tricky when you're trying just out of pure, it's different every month. Sometimes patients with PCOS can ovulate a little bit later in the cycle. If you have more questions kind of about your cycles, if you're tracking with Premom, a virtual consult might be a really good idea. There's myself, there's Dr. Habe, there's a whole bunch of providers that you can book right through the app. And we could go over everything in really great detail. Next question, Rachel, can you have breakthrough bleeding from a fibroid and still ovulate? Yes. So fibroids are known to can cause irregular bleeding if they impact the endometrial lining. That endometrial lining is sensitive to pregnancy, but as long as it's thick and adequate enough, it can still have an embryo implant. However, any type of irregular bleeding mid-cycle always does warrant a discussion with your provider just to make sure nothing bigger is going on or anything like endometritis, which would be an infection of your endometrial lining. But yes, you can still have we have tons of patients come through with fibroids. As long as that fibroid is not impacting the uterine cavity, you can definitely conceive with a fibroid and some breakthrough bleeding. However, if you're having really heavy bleeding, that could make it difficult to conceive because that endometrial lining, we like to see it at least 7 millimeters. It's not something you can measure at home, but just kind of as some general advice. As long as the lining is thick enough and your hormones are there to support pregnancy, the fibroid will not reduce your chances. All right, I think those are all of the questions that we have so far. So I'll give everyone another minute or two to submit questions. Let's see what's going on. Is progesterone of 3.55 considered ovulation? Yes, Shanice. So 3.55 does confirm that you did ovulate. Anything over 3 confirms ovulation. However, in the luteal phase, so about 7 days post-ovulation, we like to see that level up over 10. However, if you did this maybe a day or two after ovulation or right when you were getting that LH peak shortly after, then 3.55 is definitely shows that you ovulated. Hillary wrote back, my luteal phase is 10, has been for a while. I've been trying for baby number 2, 8 cycles now. Baby 1 got pregnant right away with my first. Any reasons for luteal phase being short? So the 10-day luteal phase is okay. It could be that you're ovulating on the shorter side. I'm sorry, like you said, on the later side, day 24. But as long as that 11 days is kind of where we want to see it, what you can do is talk to your provider possibly about doing a serum progesterone level, which would be blood work, about 7 days after ovulation. We'd want to see that level up over 10. Luteal phase defect has been studied closely, and ultimately they are not finding it as a valid reason, not valid, but as a reason that has a lot of credibility in terms of preventing pregnancy. There is an inflammatory cascade that starts right prior to your period, and that's why it needs to be about 10 days. However, the 10 days should be enough after ovulation to support potential pregnancy. However, I don't know your age, but anything over 35, if you've been trying over a year, warrants a discussion either with a reproductive endocrinologist or your OBGYN. All right, Katie, one more. Why do I have 29-day cycle but only 10 to 11 luteal phase? So the factor that causes the variability in cycle length is your follicular phase. So the luteal phase is pretty consistent month to month for most clients. Sometimes it can vary a couple of days, but say you ovulate day 10 on one cycle, which would be really early, and have an 11-day luteal phase, your whole cycle would be 21 days. If you ovulate on day 20, but still have that 11-day luteal phase, your cycle may be 31 days. So the part that changes your overall cycle length is that follicular phase and how long it takes you to get to ovulation. All right, Misty says, we'll do one or two more questions. Is there any good vitamins to take to help with ovulating besides prescribed Clomid? So the best thing you can do to help with ovulating is to just really reduce inflammation in your body. This comes from diet, exercise, really just overall making sure that your body is in a good state. I would consider taking a fish oil. Fish oil is known to reduce inflammation in the body. There's a brand that I personally really like called Nordic Naturals Pro Omega 2000. I don't get any kickback or anything from that. It's the one I personally take and take through pregnancy. But that one is known to reduce inflammation pretty strongly. Other things would be CoQ10. That's an antioxidant that's known to help improve egg health. But overall, that's not going to change your ovulation time. Optimal body weight is one thing that's really important. If you are overweight or your BMI is elevated, a reduction in 5% of your body weight has been shown to improve fertility. Yeah, so ovulation is just going to be best controlled by having healthy body weight, healthy sleep. There have been studies that show 10 minutes of meditation daily can help reduce cortisol, which is the stress hormone in the body. That can sometimes impact your cycle. Really high cortisol levels or really high stress. I've had clients report that, in really high times of stress, either with home stuff or work stuff, they miss their period. So it's something that I would definitely consider is 10 minutes of meditation a day. There's an app called Insight Timer. It does guided meditations or offers them. You can filter by time length. They're not religious. You can choose religious ones, but they also have ones that are just breath work, and that may help kind of regulate hormones too. All right, we're going to do one or two more questions here. Can you continue herbal supplements or inositol when you fall pregnant? Yes, so inositol you can continue while pregnant. Some herbal remedies, though, are not safe in pregnancy, so I would definitely talk to your personal OBGYN provider. Inositol is something that can be stayed on, but the goal with taking inositol or metformin is to help regulate your cycles. So once you are pregnant, the benefit that's coming from it is not nearly as great as taking it prior to pregnancy. And then Sperry says, what if you're underweight and can't gain weight? So if you're underweight and can't gain weight, there's a few things going on there. You may need to have your thyroid evaluated to make sure that your thyroid is functioning properly. And then I actually run a website called Nourished Mama personally on the side of this. It goes over a lot of nutrition detail. I have an Instagram called Nourished Mama. You can look out for nutritional stuff. You want to make sure your fat intake is really high, healthy fats like avocado, flaxseed, chia seed, steel cut oats, egg yolks, all of those things that are really nutrient dense and calorie dense. But again, make sure your thyroid is functioning properly. And then we're going to do one more question here. My OBGYN has requested an endometrial biopsy during my period. Is that a normal time to do it? It can be. It's tough to do it during your period because we may just get some of the menstrual blood, but unfortunately I can't really comment too much on that because I don't know your medical history. But an endometrial biopsy can be really helpful to look for infection or inflammation of your uterine lining. Melatonin is safe while trying to conceive. You can take melatonin prior to, and then what I would do is once you ovulate or once you're pregnant, talk to your personal provider about if you should continue melatonin, but while you're trying to conceive, it is okay to stay on. I think we're probably going to see if there's one or two more questions and then we'll wrap it up from there. And then I know we will be looking at comments that we can have sent over to me, and I will try and get back to those for anyone who missed this or missed the opportunity. But hopefully I was able to answer questions for you today. And if you do have follow-up questions, I will be answering them in our Q&A newsletter that goes out once weekly. So when you guys post your questions to the Facebook group, those get put in a profile for us. I sit down, I read them, I think about them, and we answer them. And then that will get sent out in about a week. So if you have further questions, just feel free to post them and then they'll get added to that newsletter that we get sent out. I think I'm going to wrap it up now. I don't see any other questions coming in. So again, I'm Steph. I'm a women's health nurse practitioner. You can find me in the Premom app under virtual consults. I love meeting with women in the community and helping you kind of sort through the finer details that I can't go over in all of these lives. But I will be seeing you guys soon again, I'm sure, to discuss another topic. Again, if you have questions, submit them and we'll get them back out to you in the newsletter soon. You're very welcome. I hope you guys have a great rest of your day. Have a good weekend. Bye.